Create a new crown and bridge case. Enter the patient information. Add the restoration to the dental chart. Click Next to begin scanning. Follow the scan sequence. The sequence can be customized in the settings if needed. Begin by scanning the antagonist arch. Then, scan the arch with the Straumann Anatomic Healing Abutment in place. Before starting the scanning phase, make sure the AHA is clean and free from any visible debris. Check that the AHA scan body is intact and has no visible defects. During scanning, ensure that the AHA scan body part is fully captured and clearly visible in the final scan. Mark the AHA scan body as the preparation tooth. The area will be highlighted in blue and rendered in high resolution. Use the handle to adjust or enlarge the cylinder if necessary. Scan the bite. Scan 3 to 4 teeth on both sides, including 3 to 4 mm of gingiva. Click Next to process the scan and move to the review screen. On the review screen, verify that all scan data has been captured accurately. In the Tooth Tagging tab, select the tooth number, then click on the top of the AHA scan body. Click Next to proceed to the export screen. Add the due date for the case. Select Straumann Access Lab and click Send. Once the scan is exported, the Straumann Access platform will launch. Choose your laboratory and click Send to submit the case.